You are welcome to my channel. Today I'll be talking about progressive supranuclear palsy. Progressive supranuclear palsy has another name, and it could be Steele Richardson-Olszewski syndrome. From the icons between the names, you will see that there are three experts here, and the three of them named progressive supranuclear palsy and clearly separated it from Parkinson disease in 1964. Progressive supranuclear palsy is a rare condition. It affects motor system the most. Gait suffers the most. There are abnormal gait, abnormal balance, and speech disorders. It also affects vision, mood, thought, and behavior. Epidemiologically, there's an onset, but it will progressively get worsened with time. It usually starts at age 60, and more men are affected than women, and about 5 to 8 over 100,000 will be affected in the population. What are the possible clinical features? The features will be variable, but there will be frequent falls, stiffness, loss of balance, abnormal gait. The clinical features will also include blurred vision, slow eye movement, difficulty downward and upward gaze, inability to close the eyelids, and prolonged blinking. Other features will include they don't keep eye contact during conversation, and some will misinterpret that to mean that they are not interested or they are dishonest. No, it is a problem. They have mask-like facies. Someone is familiar with that? In Parkinson disease, right? Or you simply call that expressionless face or flat affect by some other group. They have altered depression and apathy with labile judgement, labile insight, and thinking. Many times they will have thought blockage. They can't solve problems requiring thinking. Anhedonia, that is, they don't have pleasure in what usually gives them pleasure anymore. They may be irritable, not because they hate you, it is because of progressive supranuclear palsy. They may become forgetful, and sometimes they display features similar to Pseudobulbar affect, laughing or crying for no reason. There may be apathy and anger spontaneously. And this is the reason why I need to explain, because some nurses would have suffered, some care aides would have suffered in group homes, because they would think that they are doing something bad or they are not doing good enough. No. And the man or the woman with progressive supranuclear palsy is not someone who doesn't appreciate what you are doing, expressing anger. Now get the fact, is the disease. Dysarthria, dysphagia, slow speech or slurred speech, might be monotonous speech. Now, I want to delve into similarities and differences between progressive supranuclear palsy and Parkinson disease. Until 1964, it was not clearly defined from Parkinson disease. Now, similarities between Psp and Pd will be that they both have stiffness, they both have movement difficulty, and they are both clumsy. But the differences are many. Progressive supranuclear palsy is rapidly progressive based on the nomenclature, while Parkinson disease takes a long time. PSP has axial rigidity, and when they fall backwards. While Parkinson disease will have forward bending, facing and gait. PSP has more speech problems, while Parkinson disease has less problems initially, but when the disease is getting worse, with time, Parkinson disease could have speech problems the more, but not at the onset. PSP, that is progressive supranuclear palsy, will have more dysphagia, but Parkinson disease will not have dysphagia early, will have dysphagia later. PSP has very bad eye movement and other associated problems with eye movement, but Parkinson disease has close to normal eye movement. Parkinson disease has more bradykinesia, but you are not likely going to find that at all in progressive supranuclear palsy. In Parkinson disease, it will improve when you administer levodopa, but you are going to find minimal changes if you give that to progressive supranuclear palsy patient. Tau protein is found in PSP. You are not going to find tau protein in Parkinson disease. You are going to find alpha-synuclein in Parkinson disease. Causes of progressive supranuclear palsy. Mostly it is idiopathic. This is where we hide in medicine. When we don't know the cause, we say idiopathic. So idiopathic simply means unknown cause. But research has brought some clue out that brainstem is in trouble with gradual degeneration. Also, there is damage to substantia nigra. Tau protein accumulation will be in the cells, also in the brain, and all will be leading to tauopathies. The cause is usually sporadic. Also, when it comes to causes of progressive supranuclear palsy, mutation in the MAPT gene could be the culprit. And certain infections that are not so identified could be responsible. And there are some unconventional agents already implicated. There are some chemicals that are not known found in food, air, and water because it was found that a particular island known as Guam has a large percentage of people with progressive supranuclear palsy, meaning the food, the air, the water in that region could be responsible, but the chemical responsible is not known today. Cellular damage by free radicals could be the culprit. How do we make the diagnosis? Well, most of the times it is misdiagnosed. Like I've said, kudos to those three experts who helped in 1964 to specifically and clearly define and distinguish Parkinson disease from progressive supranuclear palsy. Before then, it's been misdiagnosed a lot, and today. It is rare, and there's no definitive procedure. But when you have good clinical history and physical examination, you will be able to make the diagnosis. So it's mainly clinically diagnosed. There will be vague symptoms that will last for a long time. Symptoms that are progressively getting worse will be the clue. And of course, past medical history and physical examination should involve full neuro examination. Still on diagnosis, we have to rule out depression and Parkinson disease. Our focus should be on eye movement, thought problems, mood changes, early gait instability, early swallowing difficulty. When we pick that, then we'll be able to tell this is not Parkinson's disease. This is away from depression. This is PSP, progressive supranuclear palsy. We can have radiological investigation in form of magnetic resonance imaging. And what would that tell us? There will be shrinkage at the top of the brainstem. That is why it is called supranuclear. Treatment. There's no need to cajole anyone. There's no cure. But you can choose from the following medications after a meaningful discussion with the neurologist or clinical pharmacologist or pharmacist in your jurisdiction. Now, you can choose ropinirole if that is what you both agreed upon, but know this, that is not so effective here. No. You may choose levodopa, but you are going to get only little effect, and the effect will be on slowness and stiffness and some balance problems. Just a little effect. Okay? Then some will use botulinum injection. For what? Well, that is to curb the excessive eye blinking. And some will pick antidepressant. What are they doing here? Because you rule out depression, right? Is to handle or relieve pain. Still on treatment, you can get weighted walking aids or that because they fall backwards. This will help them. Bifocal prisms as eyeglasses. You know, they have a lot of trouble with eye movement. Regular exercise will help. And of course, percutaneous endoscopy gastrostomy for feeding because of dysphagia. And of course, deep brain stimulation, just as you would do in Parkinson's disease. Finally, the prognosis. Well, from the nomenclature, progressive supranuclear palsy will become worsened progressively and could be complicated with pneumonia. Pneumonia is the commonest cause of death in them. They will be choking now from aspiration, from dysphagia, head injury from falls, fractures from falls, and they could be down with severe disability within 3 to 5 years. The lifespan is about 10 years from the time of the diagnosis. Well, it's a horrible condition. Nobody prays to have it. My heart goes out to everyone having this very horrible neuro problem. With this, I come to the end of this very presentation as per progressive supranuclear palsy. Thanks to those 3 experts who did the job in 1964. And today, I've been able to present the differences between this neuro problem and another neuro problem called Parkinson's disease. And you can share this presentation with everybody affected, everyone you know, and anyone who would like to learn more. Thanks for listening. Remember to subscribe as well. I appreciate it.